The Ministry of Health and Welfare is moving to ease the plight of overworked doctors. Starting September 1st, work hours for resident physicians will be capped at 80 hours per week. And for the first time, they will be eligible for the workplace rights and protections of the Labour Standards Act. Many in the medical community are cheering the new 80-hour rule, but some fear it could compromise patient safety during long surgeries.
In 2009, an overworked resident physician at Chi Mei Hospital collapsed from a heart attack in the operating room and was left with brain damage. To prevent similar incidents, the government says the Labour Standards Act will be expanded to cover resident doctors, in particular to limit them to 80 working hours a week.
In
the future, the policy's repercussions will be seen when doctors, especially young residents, come to the end of the weekly limit. What happens when the operation is half done, but the surgeon has already worked for 78 or 79 hours? Does the surgeon leave after 1 hour? You should have 2 surgical teams on rotation. You shouldn't be trying to squeeze all you can out of doctors and forcing them to overwork.
To protect attending physicians, the Ministry of Health and Welfare has drafted amendments to the Medical Care Act. The draft adds a section dedicated to the labor rights of attending physicians, doctors who have already completed their residency.
The draft grants priority to attending physicians' right to workers' compensation, and it legally defines the retirement plans, the distribution of medical responsibility, and the work rights and benefits. The provisions on working hours strive to respect the autonomy of the physician. We retain flexibility as we contractualize the working conditions. That's how we nail down the principles.
The health official said it would be hard to find a one-size-fits-all solution for Taiwan's diversity of attending physicians, but he said that in principle, attendings should not work more than 80 hours a week.